You probably climbed into bed last night without thinking twice about it, rolled into whatever position feels normal, closed your eyes, drifted off. But while you were unconscious, your blood vessels were doing something you never felt and were never warned about. One common sleeping position puts steady, low-grade pressure on a major vein in your body, night after night. And the effects build so slowly that by the time anything shows up, the pattern's already been running for years. In the next few minutes, I'm going to walk you through which sleep habits researchers are increasingly flagging as worth paying attention to, and exactly what to do about it starting tonight. Here's a fact that surprises most people. Stroke risk isn't flat across the day. It spikes in a very specific window, the first few hours after you wake up, driven by a natural surge in blood pressure and stress hormones as your body shifts from sleep to waking. That's not a scare tactic, that's a well-established circadian pattern. And it means what happens to your blood vessels overnight, the hours leading up to that surge, actually matters more than most people realize. I'm Marcus, and over the next few minutes, I'm going to walk you through 5 sleep habits, ranked from mildly concerning to the one I genuinely encourage you to change tonight. Then 2 positions that the research consistently favors, and why. Before we get into it, drop a comment. Are you a back sleeper, side sleeper, or stomach sleeper? By the end of this, you'll know exactly where your habit lands on this list. Number 5, lying completely flat with no head elevation. This one catches people off guard because it feels like the healthiest option. Spine aligned, weight evenly distributed. Plenty of wellness advice tells you this is ideal. But there's a wrinkle, especially past 60. When your body is perfectly horizontal for 7 or 8 hours, blood has an easier time pooling toward your head since gravity isn't helping drain it back down. In a younger person with elastic, responsive blood vessels, the body compensates without much trouble. As arterial walls stiffen with age, that compensation gets less efficient, and some research links flat sleeping to modest increases in overnight intracranial pressure. Research published in sleep medicine journals has found that even a modest head elevation, somewhere around 15 degrees, measurably reduces that pressure and improves how well blood drains back toward the heart. Here's a pattern that shows up a lot. Someone wakes up a little dizzy, stands too fast, and the room tilts for a second. They chalk it up to age or dehydration. Sometimes that's exactly what it is. But it's also worth knowing that flat overnight positioning can be part of that picture, and it's an easy thing to test for yourself. We'll get to the fix shortly, but first, the next one. It surprises almost everyone I explain it to. Number 4, right side sleeping, if you manage blood pressure or heart function issues. This sounds oddly specific, so stick with me. The anatomy explains it. Your heart sits slightly left of center in your chest. When you roll onto your right side, your body weight shifts in a way that can put mild pressure on the inferior vena cava, the largest vein in your body, responsible for returning blood from your lower body back to your heart. Even mild, sustained compression means your heart may need to work a little harder to pull that blood back in. For a healthy 30-year-old, this is nothing. Cardiac reserve handles it easily. For someone managing blood pressure with medication or with reduced cardiac output, it's a small extra workload stacked on for 7 straight hours every night. Here's something clinicians have observed anecdotally for years. People with heart failure often stop sleeping on their right side entirely on their own. Without knowing the anatomy, their body just seems to prefer the other side. Some research into sleep positioning in cardiac patients has associated left-side sleeping with more stable heart function overnight, though this is still an area researchers are actively studying rather than a settled, universal rule. If you commented right side earlier, stay with me because number 3 applies to you too. Number 3, stacking 3 or 4 pillows under your head. People do this for real reasons. Acid reflux, congestion, sinus pressure, and some elevation genuinely helps. But here's the part that gets skipped. Pile that many pillows up, and your neck bends forward at a steep angle instead of a gentle curve. Running along both sides of your cervical spine are the vertebral arteries, vessels that help supply blood to your brainstem and cerebellum, the regions handling balance and coordination. Sustained, steep forward flexion of the neck has been shown in some research to reduce blood flow through these vessels. You won't feel it happening in the moment. There's no sharp pain, no alarm. But that stiff neck and dull ache at the base of your skull some mornings isn't always just a bad sleeping position. It can be a sign the angle itself is the problem. A simple, well-supported single cervical pillow, instead of a stack, is often enough to fix this. Some people notice a real difference within a couple of weeks of switching, but we're only at number 3. Number 2 is where this starts to matter more for a lot of people over 55. Number 2, sleeping tightly curled in a fetal position all night. This is one of the most common sleep postures across every age group, and it feels instinctively protective. Knees pulled up, chin tucked, arms folded in. Physiologically, it creates two separate issues that can compound each other. First, breathing. Curl tightly enough and your rib cage compresses. Every breath is a little shallower than it should be. That can't quite get a full breath feeling some people notice right after waking can be related to hours spent in a restricted position. Reduced lung expansion over time means somewhat lower blood oxygen levels, which matters more if you're managing a cardiovascular or early pulmonary condition. Second, the same vertebral compression issue from the pillow stacking section can happen here too. Sustained neck and upper back flexion, this time from your own body position instead of an external pillow tower. Someone wakes up foggy, a little unsteady standing up, and assumes they just slept badly. Sometimes that's exactly it. But it's worth knowing that hours of restricted breathing overnight is a real, physiological contributor worth ruling out. The fix isn't complicated, and I'll walk you through it shortly. But first, number 1, because this is the habit I genuinely encourage you to change tonight if it applies to you. Number 1, going to bed within 2 hours of a large meal or alcohol. I know this one hits close to home. Family dinner, a glass of wine to unwind. It's woven into a lot of evenings, but this combination deserves real attention. Here's the mechanism. A substantial meal pulls a meaningful volume of blood toward your digestive system to support digestion. That's completely normal, but it means less blood circulating elsewhere during the hours right after eating. In a younger person with flexible vessels, the body manages that redistribution smoothly. In someone with narrowed arteries or reduced cardiac reserve, that shift can contribute to dizziness or lightheadedness, especially overnight. Now layer alcohol on top. Alcohol is a vasodilator. It opens blood vessels and drops blood pressure. In someone with stiffer arterial walls, that sudden drop can trigger a compensatory rebound, blood pressure swinging down and then back up. The American Heart Association has written about how even moderate drinking close to bedtime can interfere with the natural overnight blood pressure dip that healthy sleep is supposed to include. And losing that dip is associated with more cardiovascular strain over time, not just that one night. If you take one thing from this video, let it be this. Try to finish your last meal at least 3 hours before bed, and if you're drinking, give yourself 4 to 5 hours before lying down. A 15-minute walk after dinner, just gentle movement, helps move blood back into general circulation and is a genuinely well-supported way to support healthy overnight blood pressure. Those are the 5 habits worth rethinking. Now here's what the research actually favors instead. The first recommended position, left side sleeping. Your heart sits slightly left of center. Sleep on your left side, and gravity works with your circulatory system rather than against it. Blood tends to return to the heart a bit more efficiently, which can mean marginally less effort per heartbeat. Here's the part that's genuinely interesting and still an active area of research. About a decade ago, researchers described a system in the brain called the glymphatic pathway, essentially an overnight waste clearance system that flushes out metabolic byproducts, including proteins like amyloid beta and tau, the same proteins implicated in Alzheimer's-related plaque buildup. Some early studies, largely in animals so far, with growing human research, suggest this clearance system may work more efficiently during side sleeping, with a possible edge for the left side specifically. I want to be straightforward about where the evidence actually stands. This is a real and promising area of neuroscience, but it's still early. It's not yet the kind of settled finding where anyone can say with certainty, sleep on your left side and you'll avoid dementia. What it does suggest is that your sleep position may matter more for long-term brain health than most people assume, which is a good reason to build a comfortable, sustainable habit now, not a reason to panic about how you slept last night. There's a practical bonus too. Left side sleeping tends to keep gastric acid where it belongs, which is part of why so many people notice less nighttime reflux this way. If you've slept on your back or right side for decades, this takes time to adjust to. A full-length body pillow held in front of you helps you stay on your side comfortably, and a smaller pillow between your knees helps if you deal with hip or knee discomfort. You will roll over during the night, everyone does, dozens of times. And that's completely normal and outside your conscious control. The goal isn't perfection. It's spending more of the night in a position that's working with your body rather than against it. The second recommended position, back sleeping with gentle upper body elevation. Not flat, not fully upright, a gradual incline, torso raised somewhere between 15 and 30 degrees, using a wedge pillow, an adjustable bed frame, or a few firm cushions arranged properly. The key detail: your whole upper body rises together, not just your neck bending at the top of a pillow stack, that recreates the exact vertebral compression problem from earlier. This position has three real advantages. Blood tends to return more efficiently from your lower body, which can help if you deal with swollen ankles or varicose veins. Intracranial pressure tends to be lower than fully flat, and your airway tends to stay more open, which can help with mild snoring or congestion. One detail people miss: put a small pillow or bolster under your knees. That preserves your lower back's natural curve and prevents strain building from the elevated angle. A genuine caveat: this position doesn't suit everyone. If you have moderate to severe sleep apnea, back sleeping can sometimes worsen airway collapse even with elevation, and left side sleeping is usually the safer default. If you have significant shoulder arthritis, though, back sleeping's reduced joint pressure can bring real relief. The point isn't a rigid rule, it's understanding your own situation well enough to pick the position that actually fits it, ideally with your doctor's input if you have any of these conditions. Which have you tried? Left side or elevated back? Tell me in the comments. I want to know what's actually working for people. Your bedroom environment. Even the right position can't fully compensate for a room working against you. Temperature first. A cooler sleeping environment, somewhere around 64 to 68 degrees Fahrenheit, helps your core body temperature drop, which supports deeper sleep stages and is associated with a healthier overnight blood pressure dip. Blue light next. Screens and bright overhead lighting after around 9 p.m. suppress melatonin production, which can delay how quickly you reach deep sleep, the stages where a lot of this overnight recovery work happens. Cervical support. A single, well-contoured pillow instead of a stack, for the reasons we already covered. And noise. Sounds that don't fully wake you can still nudge your nervous system out of deep sleep for a moment. Heart rate ticks up briefly, stress hormones spike slightly. You won't remember it in the morning, but it adds up across the night. A white noise machine or good earplugs can help keep that environment more consistent. If you want to go further, a pulse oximeter can track overnight blood oxygen, and a lot of smartwatches and rings now track heart rate variability, both worth knowing about if you're managing a cardiovascular condition. A simple habit that works for almost everyone, though. A quick morning note on how you slept: headache, dizziness, grogginess, or none of that. Patterns show up in that kind of log that never come up in a 15-minute doctor visit. I want to be clear about something. None of this, the positions, the environment tweaks, the tracking, replaces an actual conversation with your doctor, especially if you have a diagnosed heart condition, sleep apnea, or anything else that changes which position is right for you. This is the kind of thing worth bringing up with them directly, because your specific situation matters more than any general rule in this video. If any of this was useful, the best thing you can do is subscribe and leave a comment on which change you're trying first: left side, elevated back, or just moving dinner earlier. It genuinely helps me know what to cover next, and it might help someone else watching connect a pattern they've been living with for years without realizing why. Next time, I want to cover something related: specific foods that research has connected to better long-term vascular health, and the surprisingly common mistake of eating them at the wrong time of day for the benefit to really land. Subscribe so you don't miss it. Sleep well and take care of yourself.